And now connecting your craniosacral experience to conception and pregnancy. So how can you apply the craniosacral therapy to that topic?
This is one of my favorite things. I work with all populations, but working with conception, pregnancy, birth, and postpartum is one of the most magical, amazing, miraculous populations that we can work with. So when you're using craniosacral therapy for, let's talk about conception first. So there can be physical restrictions that are creating fertility challenges. So let's say you were a cross-country runner as a woman, as a teenage girl in high school, you were a cross-country runner and you had a fall and your pelvis got shifted. And so say one ilium was forward, one ilium was back, and it was going over a long time and you're still running and you're kind of building compensation patterns within that. The way the uterus is held within the pelvic bowl with all of the many ligaments that support it and hold it in there, it actually can literally get shifted to one side or the other. It can get tilted forward or tilted back and held in those positions, which is going to impact its ability to have a comfortable menstrual cycle, to be able to conceive. Those fascial restrictions, those ligamentous connective tissue restrictions can impact function in that way. So there's lots of ways you can come in with manual therapy, including craniosacral therapy, to rebalance, gain more symmetry of the uterine position. That's just one example. So there can be physical restrictions that are creating fertility challenges. And that actually can be on both sides. I've worked with men who had challenges, physical restrictions within their reproductive system that were creating functional challenges leading to infertility. So from a purely physical perspective, we can make a change. We can facilitate hormonal balance going from the pituitary, the hypothalamus, pineal glands, where those reproductive hormones are being produced, but they have to get down to the pelvis to impact the end organs that they need to impact. And so you can work with balancing out the hormonal system, the endocrine system. That can make a big difference. There also can be emotional or stress-related challenges to infertility. Most of us have heard stories of people who are trying and trying and trying to conceive, and then finally realize it's not going to happen for us. We're just going to let that go, and then they get pregnant, right? So there's this huge emotional stress component to wanting to conceive, not being able to conceive, and there can be a lot of experiences that we've had in our lives that can contribute to some of that emotional, I'll call it a restriction, a challenge that is creating a physical challenge with conception. And so one of the things I love about craniosacral therapy is that it accesses where in our bodies we're holding emotions. If you read Candace Pert's book, Molecules of Emotion, you realize emotions really are physiological events. And we store mostly our negative emotions in our tissues. And it's funny because I've never yet come across a client who was holding a pocket of joy somewhere in their body that they didn't want to let themselves feel. We let ourselves feel the positive emotions, but those negative ones we tend to not want to feel, and so we stuff them in our body, and they get stored there until you can come along with, and there are different modalities. Craniosacral therapy is my modality of choice for accessing that emotional restrictions or imprints in the tissue, but there are other ones as well. But you can come in and help shift how our bodies are holding our story in our tissues in a way that can be more functional.